ancaman digital terhadap masyarakat sipil di Asia Tenggara. Kita tahu bahwa pandemi COVID-19 telah berdampak tidak hanya bagi kesehatan masyarakat, tetapi juga hak warga ya. Pandemi ini semakin membatasi akses masyarakat terhadap pelayanan kesehatan, penghidupan yang layak, karena mereka sulit untuk meninggalkan rumahnya ketika mereka memerlukan layanan tersebut atau ketika harus mencari penghasilan. Di tengah kekosongan atau kurangnya dukungan dari pemerintah, inisiatif mandiri berbasis komunitas bermunculan untuk menolong masyarakat yang terdampak dalam memenuhi kebutuhannya. Apa saja bentuk inisiatif solidaritas sosial yang muncul dari masa yang sulit ini? Webinar kali ini akan membahas berbagai inisiatif masyarakat sipil yang telah dilakukan untuk membantu masyarakat baik di Indonesia maupun dari Malaysia, Filipina, dan juga negara Asia Tenggara lainnya. Kali ini ada 5 pembicara yang akan berbagi pengetahuan dan pengalamannya di forum ini. Pertama ada Bapak Iskandar Saharudin dari Koalisi Warga Lapor COVID-19. Pak Iskandar sebagai relawan di bagian laporan warga, media sosial, dan advokasi. Beliau juga memiliki pengalaman bekerja di isu hukum, isu SDGs, dan anti korupsi. Lalu yang kedua bersama kita ada Ibu Heriayati dari JRMK atau Jaringan Rakyat Miskin Kota, sebuah organisasi masyarakat sipil yang bekerja bersama komunitas marginal perkotaan. Beliau juga ketua koperasi di Kampung Elektro di Jakarta Utara. Lalu ada Ibu Romlawati dari Peka, pemberdayaan perempuan kepala keluarga. Ini adalah sebuah yayasan yang melakukan pengorganisasian dan pendampingan pada kelompok perempuan kepala keluarga. Beliau sebagai Deputi Direktur Pengorganisasian Masyarakat. Yang keempat dari Filipina, kita akan mendengarkan pengalaman dan pengetahuan dari Ananesa Angin Abad. Dia adalah Senior Research Associate Program on Alternative Development, University of Philippines Center for Integrative and Development Studies. Yang terakhir, kita ke Malaysia, ada Ibu Sumita Santini Krishna. Beliau adalah Direktur Lembaga Auduni, sebuah platform NGO yang mengadvokasi pemangku kepentingan pemerintah dan swasta untuk mengembangkan sistem migrasi yang mendukung bagi non warga negara yang sesuai standar dan norma internasional. Ia juga koordinator koalisi NGO di Malaysia bernama Migration Working Group Malaysia dan ketua Migrant Forum in Asia. Baik, kita langsung saja memulai diskusinya. Kita mulai dari Bapak Iskandar. Pak Iskandar bisa tolong ceritakan bagaimana inisiatif lapor COVID-19 ini muncul, mungkin, lalu bagaimana tantangan dan dinamikanya, sejauh mana proses kerja dan bagaimana dampaknya. Saya persilakan kepada Bapak Iskandar bicara maksimal 15 menit. Ya, silakan Pak.
Ya, terima kasih. Ziko. Selamat pagi teman-teman sekalian. Saya diminta bicara tentang pengalaman di bagaimana kerja-kerja di lapor COVID itu. Jika teman-teman menghadapi satu masih ingat tentang peristiwa.
Mohon maaf Pak, volume suaranya bisa ditambah Pak.
Oh ya, maaf.
Ya.
Ya, tentu kita menyaksikan sendiri bagaimana respon dari pemerintah. Nah, ketika pandemi awal mulai muncul di Wuhan, di Cina, dan mulai menyebar ke berbagai pelosok dunia, di Indonesia belum datang pandemi itu. Dan saat itu, bahkan pada saat datang pun, di awal Maret, respon pemerintah juga masih seperti cuek, ya, seperti mengabaikan, dan itu membuat banyak orang gelisah, banyak warga negara gelisah. Dan sebagian dari kami di sekumpulan orang-orang yang, karena kami melihat ada setidaknya ada dua problem esensial yang pandemi COVID-19 ini. Yang pertama, dalam penyajian data kematian, pemerintah tidak secara terbuka menyampaikan berapa jumlah yang meninggal karena COVID. Padahal sesuai dengan standar WHO, yang meninggal karena COVID itu mestinya dibuka seluruhnya, baik itu yang ODP, yang PDP, atau yang sekarang bahasa yang suspek maupun yang probable, tidak hanya positif saja atau yang terkonfirmasi. Nah, karena kegelisahan melihat fakta, ada beberapa teman yang gelisah, yang marah ini berkumpul. Di antaranya ada dari ICW, dari Lokataru, kemudian YLBHI juga, dan beberapa NGO lainnya, serta epidemiolog, serta para peneliti, serta beberapa aktivis. Itu berkumpul kemudian mencoba untuk melakukan sesuatu. Dan tadi kembali ada dua hal yang ingin kita sasar. Kenapa lapor COVID ini hadir? Yang pertama tadi, underreported terhadap laporan kematian dari kasus-kasus COVID-19. Yang kedua, kami berharap bisa menyajikan satu media alternatif pengaduan warga. Karena sejak pandemi ini terjadi, belum ada satu media pengaduan yang cukup serius untuk fokus menangani problem-problem yang dihadapi warga terkait dengan COVID-19 ini. Maka muncullah lapor COVID ini. Tentu basisnya pada prinsip yang coba kita usung, yaitu kolaborasi, partisipasi, transparansi, karena itulah nilai-nilai yang kita perjuangkan bersama. Dan karena prinsip kita kolaborasi, partisipasi, dan mencoba untuk melibatkan sebanyak mungkin warga untuk berpartisipasi di dalam proses pelaporan, mengumpulkan data, maka kita mencoba untuk menggalang para relawan. Maka jaringan relawan di lapor COVID ini terbentang dari seluruh Indonesia, tidak hanya Jawa saja, tetapi juga ada dari ujung Sumatera sampai ke Papua. Pendekatan yang kami pakai di lapor COVID itu pendekatannya dari bottom up. Jadi data-data yang dihimpun oleh para relawan itu berasal dari website kabupaten kota, jadi masing-masing Pemda.
Pak Iskandar bisa tambah lagi volumenya.
Oh iya.
Oh ya, mungkin deketin
Maaf.
mic ya. Ya, baik.
Oh, iya.
Ya.
Jadi tadi sampai mana ya? Oh ya. Jadi pendekatan kami pendekatan kolaborasi. Jadi kita mencoba untuk mengorganisir banyak relawan, dan relawan kami ada sekitar 200 orang. Itu terbentang dari Sabang sampai Merauke. Mencoba mengejar dua hal tadi. Yang pertama adalah menyampaikan data-data kematian COVID-19 yang tidak tercover oleh pemerintah, atau yang mungkin tidak diungkapkan secara terbuka oleh pemerintah, melalui pendekatan dengan mengumpulkan data-data dari website pemerintah di level kabupaten kota. Data itu dikumpulkan setiap sore, kemudian dikumpulkan oleh tim IT dan disajikan secara setiap minggu kami sajikan ke publik sehingga warga mendapatkan informasi yang cukup berimbang tentang situasi yang sebenarnya dihadapi. Lalu yang kedua tentang media alternatif pengaduan warga. Di media alternatif pengaduan warga itu kami menggunakan pendekatan citizen reporting atau crowdsourcing dengan memanfaatkan chatbot. Chatbot kami tersedia ada di 2 media yaitu WhatsApp dan Telegram bot. Saat ini juga membuka peluang untuk melalui menerima pengaduan warga melalui media sosial seperti Twitter, Facebook, dan Instagram. Nah, di samping ada 2 kegiatan itu, yaitu pengumpulan data kematian dari seluruh kabupaten kota. Lalu yang kedua, kita mencoba untuk melakukan membantu warga untuk menyalurkan pengaduan hal-hal apa yang mereka alami, termasuk informasi tentang keramaian atau anggota keluarganya atau dirinya yang menghadapi problem terkait dengan COVID-19. Lapor COVID juga melakukan beberapa survei terkait dengan problem epidemiologi yang dihadapi oleh masyarakat. Saat ini sudah dilakukan survei di 3 kota, yaitu DKI, di Bogor, dan di Surabaya. Dan kegiatan yang terbaru dan saat ini sedang cukup menjadi concern sebagian dari kami adalah pusara digital. Ini monumen digital yang kami bangun untuk memberikan penghargaan, penghormatan kepada para tenaga kesehatan nakes yang wafat, yang gugur karena melawan COVID. Para nakes ini tidak hanya dokter, tetapi juga ada dokter gigi, ada perawat, ada bidan, ada tenaga administrasi, bahkan ada tenaga laborat, sanitarian, dan terapis. Dan sudah ribuan masuk ke kami testimoni baik itu dari keluarga, dari kolega, dari ibu, maupun dari orang tua para nakes yang telah wafat, maupun dari anak dan sebagainya. Pusara digital ini menjadi satu bentuk penghargaan inisiatif dari masyarakat terhadap para nakes yang telah gugur dan berjuang di garis depan. Dari catatan kami, setidaknya ada total 248 nakes yang telah gugur per hari ini. Per hari ini ada sekitar 130 dokter, 9 dokter gigi, 22 bidan, kurang lebih 92 perawat, dan 2 laboran, dan masing-masing 1 ada di sanitarian, TU, dan 248 nakes ini hampir gugur. Jadi jika teman-teman mencermati perkembangan, saya kadang ketika mengikuti pengumpulan data terkait dengan nakes-nakes yang wafat ini sangat banyak yang meneteskan air mata yang sedih karena tercurah emosinya. Oh iya. Dan mungkin untuk sementara ini dulu, mohon maaf sebelumnya. Dan ya untuk rencana ke depan, besar di kita rencana akan dikembangkan. Jadi selain memang dimanfaatkan sebagai monumen penghargaan dan penghormatan pada para nakes dan mengumpulkan testimoni, juga akan menjadi pusat data riwayat hidup dan riwayat sakit dari para nakes itu. Dan kami juga akan mencoba mengembangkan chatbox itu menjadi lebih interaktif agar dan juga interoperabilitas dengan lapor media lapor yang lain seperti lapor.id atau mungkin dengan yang dikelola oleh pemerintah dan dengan jaga yang dikelola oleh KPK. Dan saat ini juga sedang mencoba mendorong karena beberapa nakes itu ternyata berasal dari keluarga yang tidak mampu sehingga dan belum mendapatkan perhatian dari pemerintah, sehingga kita coba dorong untuk melakukan penggalangan dana. Mungkin demikian yang bisa saya sampaikan. Terima kasih.
Baik, terima kasih Pak Iskandar atas presentasinya yang menarik ya dan penting mengenai inisiatif warga dari berbagai wilayah untuk mengumpulkan dan menjalankan laporan masyarakat terkait COVID-19 ya. Tadi juga disebutkan rencana ke depan yang menurut saya menarik dan penting seperti pengembangan usaha digital, pengembangan chatbot interaktif, dan advokasi ya yang paling penting ya. Baik, kita sekarang menuju ke pembicara yang kedua. Saya persilahkan Ibu Heriayati. Ibu Heriayati dari JRMK, bisa ceritakan Bu bagaimana kondisi komunitas dampingan JRMK sebelum pandemi dan ketika pandemi terjadi, lalu apa tantangan yang dihadapi ketika pandemi dan PSBB yang pertama diterapkan. Dan hal lainnya misalnya yang paling penting adalah apa yang dilakukan oleh JRMK dan komunitas dampingannya. Ya, silakan Ibu Heriayati, waktunya 15 menit Bu. Ibu unmute dulu Bu, unmute. Maaf, unmute dulu Bu.
Ayo. Ya. Terima kasih Kak Jiko telah memberikan waktu buat saya. Perkenalkan, saya Herdayati dari Jaringan Rakyat Muslim Kota. Saya dan teman-teman di JRMK waktu pertama kali menghadapi pandemi sangat-sangat bingung dan kaget waktu itu ya. Cuman awalnya kalau sebelum pandemi itu kita ya semua berjalan dengan lancar, yang dagang juga berjalan dengan lancar, normal, baik-baik saja, penghasilan juga lumayan. Tapi setelah juga beca juga penarik beca, karena kita berdampingan kita tuh ada kampung, ada pedagang kaki lima, ada juga beca. Nah, sebelum pandemi berjalan dengan normal biasa, tapi setelah pandemi, awal-awal pandemi itu benar-benar terguncang karena semuanya total, semuanya itu berhenti semua yang usaha-usaha, baik itu PKL, baik itu di kampung juga, kita orang-orang kampung juga sangat kesulitan. Nah, juga untuk teman-teman beca juga apalagi yang dampaknya besar banget, besar sekali. Kita dari organisasi yang kita lakukan itu apa yang mesti kita lakukan saat itu, kita berpikir apa yang untuk menyelamatkan diri kita itu apa. Akhirnya kita berinisiatif, teman-teman JRMK, teman-teman semua, kita berinisiatif untuk membuat sanitizer. Itu yang pertama kali kami lakukan. Dan penggalangan dana yaitu dengan kita bisa edit.com. Dengan penggalangan dana itu uangnya kita alokasikan untuk pembikinan sanitizer, terus juga kita penggalangan dana untuk teman-teman yang mau diam di rumah itu kita berikan santunan 300 kita melakukan yaitu dengan penggalangan dana, yaitu dengan melakukan kerjasama dengan perajin jamu di Jogja, yaitu dengan memesan wedang ubuh untuk dibagikan ke teman-teman kampung, juga beca, juga PKL. Juga kita juga memberikan uang dapur untuk teman-teman yang pengganti uang dapur itu sebanyak 80.000 untuk 1 minggu. Itu kita totalnya untuk 1 minggu itu 560. Nah, itu kita dapatkan dari donasi yang dilakukan teman-teman JRMK, yaitu dengan kitabisa.com. Kita juga menjual beras murah untuk pangan melalui bekerja sama dengan petani kendeng, yaitu dengan menjual donasi ke warga itu hanya 5.000 dengan pembelian 9.000, dan untuk mencari dana untuk itu kita juga dari dengan penggalangan dana kitabisa.com. Itu yang dilakukan. Nah, karena kebetulan di elektro itu ada zona merah, saya terdampak. Kebenaran saya juga di elektro, saya juga sebagai pengurus organisasi JRMK, termasuk salah satu pengurus JRMK, juga saya juga warga di elektro. Elektro itu waktu itu kena zona merah karena ada beberapa warga kami ada yang kena corona. Yang saya lakukan pertama waktu itu untuk membantu teman-teman yang kena corona, karena memang sangat sekali mereka merasa dikucilkan, merasa kecewa, merasa sedih, dan orang-orang takut semuanya dengan tetangga yang kena corona. Bagaimana kalau supaya teman-teman itu tidak dikucilkan, tapi juga dia mendapat akses makan. Akhirnya saya berinisiatif untuk pendekatan kepada teman-teman yang kena COVID itu dengan menanyakan kenapa dan bagaimana, kenapa dia mengurung diri. Akhirnya saya dengan pendekatan, saya bilang ke warga-warga, ayo teman-teman, ini ada warga yang kena musibah, sedangkan mereka butuh makan. Kalau mereka makan, kita kasih beras bahan mentah, pasti mereka akan kekurangan beli cabai, beli bawang. Nah, untuk supaya mereka juga tidak kelaparan, tapi dia tetap sehat, ayo kita penggalangan dana untuk ngasih makan teman kita yang sakit tadi itu. Selama 2 hari saya melakukan itu, tapi karena semuanya juga teman-teman di kampung juga karena semuanya dalam keadaan kesulitan, akhirnya saya ceritakan ke organisasi. Dari organisasi akhirnya memberi bantuan pangan untuk teman-teman yang kena corona. Awalnya yang kena corona itu cuma 1, akhirnya bertambah lagi jadi 4, bertambah lagi jadi 23, tambah lagi. Nah, itu terus dan banyak, dan itu terus. Akhirnya tempat kami itu di lockdown. Nah, akhirnya karena terlalu banyak bertambah lagi yang kena corona, kita teman-teman JRMK mengusulkan ke Pemda untuk merapid atau men-swab teman-teman yang ada di elektro. Jadi biar kita tahu mana yang kena, mana yang enggak, biar cepat terobati. Akhirnya terjadilah kita akhirnya di swab massal di elektro, akhirnya terjaring ada 100 lebih yang di swab, yang kena waktu itu 23 orang. Dan berkat teman-teman dari teman-teman jaringan teman-teman yang lain seperti JRMK dan teman-teman Rujak membantu, akhirnya teman-teman yang sudah kena positif cepat dibawa ke rumah sakit dan langsung dirawat di sana. Kalau setelah pandemi sekarang, kita sekarang ini ya kalau sekarang itu makin memburuk ya, karena dulunya yang PKL yang tadinya bisa berdagang di Ancol, karena Ancolnya tutup, akhirnya mereka tidak berdagang. Itu ada teman dampingan JRMK itu ada 53 PKL yang sekarang benar-benar nganggur, tidak bekerja sama sekali. Nah, untuk beca juga sekarang itu setelah pandemi ini penghasilan mereka pun sangat minim, dari yang biasanya dapat 50-80 ribu, sekarang dari pagi sampai sore hanya dapat 20 ribu atau 40 ribu, bahkan ada yang nggak dapat itu di daerah Trogong. Nah, untuk warga saya sendiri di sini di kampung, karena di sini di tempat, terutama di daerah saya di kampung elektro, itu banyak yang bekerja di pabrik-pabrik. Banyak yang kena PHK karena memang tidak bekerja, karena pabriknya tutup. Yang kalau banyak juga yang harian lepas itu, jadi kalau pabriknya nggak kerja, nggak beroperasi, ya mereka tidak digaji. Kalau selama ini, kalau untuk teman-teman di kampung untuk mengatasi sebenarnya, karena memang ada bantuan dari Pemda. Dari Pemda yaitu, tapi tidak bisa mengatasi semuanya ya. Memang kalau untuk beras memang warga semua dapat. Tapi kan kita tidak cukup dengan itu, karena anak sekolah harus bayaran, tetap harus bayaran, kontrakan rumah harus dibayar, itu semuanya tetap harus itu. Kita juga memang waktu kemarin kita sebelum pemerintah seperti melakukan ada orderan untuk jahit masker, tapi itu pun tidak berlanjut lama karena cuman beberapa kampung yang disupport seperti itu, dan itu sudah tidak melakukan lagi.
Ya.
Kalau ya tantangannya untuk organisasi, terutama untuk virusnya itu sendiri. Bagaimana virusnya itu sendiri dengan teman-teman kita? Bagaimana kita bisa membantu teman-teman, tapi kita juga sehat, kita juga selamat dari nggak kena itu. Nah, kita telah melakukan, akhirnya kita gimana caranya, akhirnya kita bikin sanitizer, kita juga membagikan masker kepada teman-teman. Kalau tantangannya kedua, secara ekonomi kita hanya tidak bisa berbuat apa-apa ya. Kita waktu kemarin dengan secara pandemi ini kita hanya bisa memberikan untuk 560 untuk satu keluarga selama 1 minggu. Dan kita hanya bisa memberikan pemahaman kepada warga agar supaya warga tetap sehat, supaya warga tidak tetap melakukan kegiatan. Kita memberikan pemahaman kepada warga supaya warga itu tidak semaunya tidak semaunya menjaga kesehatan diri masing-masing lah. Jadi supaya tetap mereka rajin cuci tangan, menggunakan masker, memakai sanitizer. Tapi kita sulit di lapangan itu sulit banget untuk warga menerapkan ke warga itu tetap untuk menggunakan masker. Walaupun kita sediakan tempat-tempat untuk cuci tangan, kita sudah sediakan untuk cuci tangan, untuk masker kita bagikan selalu, baik itu dari kita, dari JRMK sendiri maupun dari pemerintah. Tapi sulit sekali untuk di kampung-kampung itu untuk menggunakan masker. Jadi padahal kita selalu memberikan pemahaman. Bahkan saya dimusuhi oleh warga, beberapa warga karena saya terlalu keras katanya kalau untuk melakukan harus menggunakan masker, bahwa ini tuh tidak ada sebetulnya penyakit itu gitu. Padahal saya sendiri ngalamin gimana rasanya ngelihat orang yang kena corona, ngebantu mereka, bahkan sampai saya bawa ke rumah sakit, dia peluk badan saya nggak, ya itu karena spontanitas tadi itu, karena itulah kesalahan saya juga. Padahal saya juga menerapkan untuk pakai protokol, saya lupa kalau saya juga kadang-kadang tidak menerapkan protokol itu karena itu spontanitas. Kalau ada warga yang yang sakit itu enggak itu. Nah, tapi tetap dari situ saya jadi pelajaran buat saya untuk tetap berhati-hati menggunakan protokol, walaupun dalam keadaan apapun saya harus menggunakan protokol itu gitu. Hanya itu dulu kali Kak yang bisa saya sampaikan, nanti mungkin bisa ditambahin.
Baik, terima kasih Bu Heriayati atas presentasinya yang menarik ya, tentang inisiatif JRMK bersama warga di Kampung Elektro di Jakarta Utara. Yang menarik adalah inisiatif ini juga ada koneksinya dengan kelompok petani ya Bu ya, di lalu dengan komunitas-komunitas lain di luar Jakarta ya Bu ya. Ya. Jadi sampai saat ini ada dampaknya ya Bu ya, yang diterima oleh komunitas ya. Ada dampaknya. Oke. Baik, selanjutnya ke pembicara ketiga, kita akan mempersilahkan Ibu Ramlawati dari Akar, Pemberdayaan Perempuan Kepala Keluarga. Ibu Ramlawati bisa jelaskan bagaimana kondisi komunitas-komunitas pendampingan Akar sebelum pandemi dan ketika awal pandemi terjadi, lalu apa tantangan yang dihadapi ketika pandemi muncul, dan inisiatif apa ya atau usaha apa yang dilakukan, dan juga mungkin dari mana sumber daya pendukungnya ya. Ibu. Silakan Ibu, 15 menit waktunya Bu Rom.
Oke, terima kasih Mas Duko atas waktu dan kesempatannya. Seperti tadi sudah diperkenalkan oleh Mas Duko, saya Romlawati dari Yayasan Pemberdayaan Perempuan Kepala Keluarga. Nah, pendampingan atau mitra utama kami adalah Serikat Perempuan Kepala Keluarga. Serikat Perempuan Kepala Keluarga adalah organisasi yang beranggotakan perempuan yang menjadi kepala keluarga. Jadi mereka menjadi kepala keluarga karena suami meninggal, ditinggal, cerai, atau suaminya sakit menahun, dan single atau lajang tapi menanggung keluarga besarnya atau menanggung dirinya. Sebagai bahan presentasi, bisa minta tolong bahan presentasi saya untuk ditampilkan. Oke, baik, bisa lanjut. Saya akan memulai presentasi ini dengan sebuah cerita. Ini yang dialami oleh kader Serikat Peka dari Bima di NTB, jadi sebuah pulau di NTB, namanya Ibu Rahma. Jadi Ibu Rahma ini adalah seorang perempuan kepala keluarga dengan 3 orang anak, jadi anaknya masih sekolah semua. Sebelum pandemi, dia ini berjualan pakaian, beras, gitu ya, kebutuhan, serta juga menjadi guru PAUD. Nah, dia juga mengajak teman-temannya yang dia organisir dalam kelompok di dusunnya dia untuk membuat kue, kemudian kue itu dijual ke warung-warung di sekitar mereka. Dan proses ini bisa mereka lakukan setiap hari, ada mereka membuat, kemudian nanti ada anggota yang mengambil barang gitu, mengambil hasilnya. Nah, modal untuk memulai kegiatan ini dari dana swadaya yang mereka lakukan melalui kegiatan simpan pinjam. Nah, setiap minggu kelompok ini bisa melakukan pertemuan, melakukan arisan, melakukan kegiatan simpan pinjam, ada yang nyimpan, ada yang pinjam, dan melaporkan hasil usaha penjualan kue. Namun, sejak pandemi, sebagian besar anggota ini, anggota dari kelompok di Desa Samili namanya, di Bima ini, yang dipimpin oleh Bu Rahma, ini kehilangan pekerjaan. Jadi pesanan tadi membuat kue menjadi tidak ada yang beli gitu, karena masyarakat di situ juga kesulitan dengan tidak punya penghasilan gitu, sehingga beberapa anggota dan tetangganya Bu Rahma itu harus pergi ke kabupaten lain di Sumbawa dan harus meninggalkan keluarganya. Mereka bekerja menjadi buruh di pertanian bawang di sana dan hanya pulang beberapa mungkin setelah beberapa lama, sehingga pertemuan kelompok juga menjadi tidak berjalan. Nah, Bu Rahma ini karena seorang pengorganisir, kasihan juga dan bingung juga bagaimana nih anggota-anggotanya. Akhirnya dia menemui kepala desanya, kemudian mengajak bicara, berdiskusi, terus dia tahu bahwa desa itu ada proyek untuk membuat masker. Jadi Bu Rahma bernego dengan kepala desa supaya pembuatan masker dilakukan oleh dia dan kawan-kawannya. Dan akhirnya proyek itu diberikan ke Bu Rahma. Jadi Bu Rahma bersama kawan-kawannya membuat masker. Tapi ini hanya berjalan 3 bulan. Setelah proyeknya selesai, kembali lagi tidak bekerja gitu ya. Tidak ada pekerjaan. Dia bingung. Akhirnya pada suatu saat kami Yayasan Peka menyalurkan sedikit dana untuk ibu-ibu PK yang terdampak dengan COVID, dan Bu Rahma menggunakan dana tersebut sebagai modal usaha. Dia membeli peralatan, kemudian dia memulai usaha, dia sebut namanya itu pentol, kayak membuat tahu dari tahu, kemudian ada isinya, dan dia bersama teman-temannya yang sesama anggota PK di desa di dusunnya itu untuk membuat dan mempekerjakan juga remaja untuk terlibat di dalam usaha tersebut. Dan usaha itu sampai sekarang berjalan. Dalam satu hari dia membuat sekitar 3.000 tahu isi, atau bahasanya mereka disebut pentol dari desa Salome. Bisa dilanjut? Nah, kasus seperti yang Bu Rahma ini juga dialamin oleh ibu-ibu PK di wilayah lain. Jadi kami bekerja di 20 provinsi, di 87 kabupaten, dan menjangkau lebih dari 1.000 desa dengan anggota 60.000 anggota serikat PK. Nah, pekerjaan utama anggota PK paling banyak memang 38% itu menjadi buruh, karena memang sebagian besar dari mereka itu memang dari kelompok, kalau ada kelompok yang termiskin di suatu wilayah itu biasanya mereka adalah perempuan kepala keluarga. Selain itu banyak juga anggota PK yang bekerja sebagai pedagang, dan banyak lagi yang pekerjaannya itu nggak tetap gitu. Jadi kami sebut lainnya. Jadi pada saat musim hujan mereka menjadi petani atau bekerja menjadi buruh tani. Kemudian di musim kemarau mereka bekerja menjadi penenun, karena banyak anggota PK juga punya kemampuan untuk menenun, dan pengrajin yang lain kami sebut sebagai artisan. Kalau yang hanya mengerjakan itu sekitar 5%, tapi banyak yang tadi tidak, kadang menenun pada saat musim panas, kemudian musim hujan berubah menjadi petani. Bisa lanjut? Nah, permasalahan dan tantangan yang kemudian kami hadapi, walaupun tadi pekerjaan yang saya sebutkan profilnya, pada saat pandemi itu banyak sekali pekerjaan-pekerjaan yang juga mesti harus beralih, ya, terutama untuk ibu-ibu PK yang berada di kota seperti Bu Herdayati, ya, memang kota lebih cukup berat untuk menghadapi pandemi ini. Jadi persoalan kesehatan tentunya. Jadi resiko terpapar virus, ada anggota juga terpapar virus di satu daerah. Kemudian alat untuk pelindungan diri juga masih sangat terbatas. Terus anggota PK kebetulan juga banyak yang lansia dan miskin sehingga sangat rentan dengan paparan COVID-19 ini. Terus layanan kesehatan juga sangat terbatas. Nah, sekarang pada saat pandemi, ibu-ibu PK ini layanan pergi ke puskesmas itu menjadi ada kesulitan karena layanan-layanannya juga sangat terbatas. Terus juga banyak saudara-saudaranya ibu-ibu PK ini pulang kampung, sehingga ibu-ibu PK selain menanggung keluarganya sendiri, dia juga harus menanggung keluarga besarnya yang pada pulang kampung dan beberapa harus kembali tinggal bersama. Kemudian tantangan dan permasalahan terkait ekonomi, tentu ada yang hilang, bahkan tidak punya, berkurang penghasilannya, terus yang petani harga panen jatuh, karena mobilitas dibatasi, tidak bisa dijual keluar dari kabupatennya, sehingga penghasilannya menjadi berkurang. Selain itu, penghasilannya berkurang, tetapi kebutuhan pengeluaran itu meningkat, terutama buat ibu-ibu yang masih mempunyai anak, karena harus membiayai pulsa untuk sekolah online. Selain itu juga itu membutuhkan keterampilan tersendiri, khususnya karena beban menemani anak-anak itu jatuhnya adalah kepada perempuan. Sehingga perempuan harus mencari nafkah kalau dia perempuan kepala keluarga, tetapi juga harus menemani anaknya untuk belajar di rumah. Di beberapa tempat juga kesulitan memperoleh bahan pokok. Nah, selain persoalan ekonomi dan kesehatan, ini juga persoalan keluarga pada saat masa pandemi ini cukup tinggi karena rentan terhadap konflik, karena tidak punya penghasilan, susah makan, dan banyak keluarga yang kemudian tinggal bareng, ini tinggal hanya di rumah, sehingga itu juga menimbulkan sangat rentan terhadap konflik. Bahkan Serikat PK di Sumatera Utara itu sampai harus beberapa mendampingin kasus perkosaan, kasus pelecehan gitu yang terjadi di lingkup keluarga. Terus juga karena tidak semua anggota PK itu bisa mengakses pakai internet, dan itu juga menjadi persoalan untuk pada masa pandemi ini. Bisa lanjut? Nah, selain permasalahan, PK juga sudah mempunyai potensi yang cukup banyak ya. Kami telah ada 87 anggota serikat PK di 87 kabupaten, di 20 provinsi dengan anggota sampai 60.000 perempuan. Kemudian mereka adalah kader dan pemimpin yang cukup terlatih dan mengakar di desa. Terus PK juga kami juga mempunyai koperasi simpan pinjam di 87 kabupaten di 20 provinsi tersebut. Terus juga kami juga mengembangkan Pekamat, yaitu sebuah usaha grosir untuk memenuhi kebutuhan anggota dan masyarakat di mana PK berada. Terus juga kami juga punya beberapa lumbung ketahanan pangan. Jadi untuk pangan pokok yang misalnya beras, jagung, itu ada simpanannya di lokasinya PK. Bisa lanjut? Selain sumber daya manusia, kami juga punya modal sosial. Jadi rasa solidaritas ini sudah terbangun karena kami sudah mengorganisir mereka hampir 20 tahun. Kemudian ibu-ibu PK ini juga sekarang fokus kepada sektor pangan, pertanian. Jadi hasil kebutuhannya juga meningkat, dan sekarang mengembangkan misalnya produksi-produksi di tingkat lokal, pangan, herbal, bumbu-bumbu itu semua diproduksi. Terus meningkatnya kreativitas ya, seperti tadi yang saya ceritakan di awal. Jadi Bu Rahmi yang beberapa kali dengan masa pandemi memproduksi ini nggak jalan, kemudian dia kreativitasnya itu berjalan. Bisa lanjut? Selain itu, kami juga dan ibu-ibu mempunyai pengalaman dalam pemetaan, pemantauan, memfasilitasi akses dan advokasi. Jadi ibu-ibu PK di beberapa tempat itu membantu pemerintah desa dan pemerintah kabupaten untuk melakukan pemetaan untuk kelompok rentan, Terus kami juga melakukan beberapa kali pemantauan dengan enumeratornya adalah ibu-ibu dengan melibatkan ibu-ibu terkait dengan bantuan sosial. Kemudian Ibu BK juga sudah biasa memfasilitasi masyarakat rentan, misalnya untuk akses perlindungan sosial melalui KLIK, Klinik Layanan Informasi dan Konsultasi. Kemudian juga memfasilitasi memperoleh buku nikah, karena banyak perkawinan di Indonesia sebagian besar itu tidak tercatat. Nah, PK memfasilitasi proses ini melalui YADU, pelayanan terpadu. Kemudian Ibu BK juga sudah punya pengalaman dan terlatih untuk melakukan advokasi penggunaan dana desa untuk merespon berbagai kebutuhan termasuk di masa COVID ini. Bisa lanjut.
3 menit lagi ya Bu ya.
Oke, dan upaya yang telah kami lakukan antara lain adalah upaya yang untuk bisa lanjut terkait dengan kegiatan tanggap darurat seperti tadi di Bu Herdayati, kami juga memproduksi masker lebih dari 20.000, kemudian didistribusikan untuk kelompok rentan. Anggota PK juga ada yang memproduksi APD, menyalurkan bantuan kayak hand sanitizer. Ini kami peroleh dari perusahaan dari L'Oreal. Kemudian untuk membuat masker, kami bekerjasama dengan pemerintah, ada dari KPPA dan pemerintah provinsi dan dari pihak-pihak lain. Kami juga menyalurkan bantuan sembako, bantuan dari pihak lain. Kemudian Ibu PK juga menjadi Satgas Pencegahan COVID. Bisa lanjut. Selain kegiatan tanggap darurat, kami juga melakukan kegiatan penguatan ekonomi, seperti pelatihan digital. Jadi kami melatih ibu-ibu untuk menggunakan Zoom, kemudian melakukan pelatihan. Terus pengembangkan sistem pertanian yang berbasis masyarakat, jadi fokus pada untuk menjaga ketahanan pangan dan memproduksi ini juga kapas seperti yang dilakukan oleh ibu-ibu di NTT. Kemudian pekamat ini juga diperluas lebih banyak. Terus mendorong adanya tetap dana bergulir untuk usaha ibu-ibu melalui koperasi, dan pada ibu-ibu yang mempunyai pinjaman itu dilakukan penjadwalan ulang. Bisa lanjut. Selain penguatan ekonomi dan tanggap darurat, kami juga melakukan pemantauan, pendataan, dan pengumpulan serta penyebaran informasi. Pada saat masa pandemi ini kami melakukan pemantauan bantuan langsung termasuk tunai untuk dana desa. Ini pemantauannya itu pada 6.559 kepala keluarga di 90 RT, di 90 desa, di 69 kecamatan, di 42 kabupaten, di 17 provinsi. Dan kami mewawancara 87 aparat desa. Proses ini melibatkan 123 kader PK di 17 provinsi. Ini kami lakukan hanya sekitar 1 bulan untuk proses pemantauan. Dan selain pemantauan, kami juga mengumpulkan data dan kasus. Jadi ini hampir mirip seperti yang dilakukan oleh Mas Iskandar. Ada terkumpul lebih dari 30 tulisan yang dibuat oleh ibu-ibu komunitas. Dan tulisan ini kami sebarkan juga kepada pemerintah lokal di mana mereka berada. Selain itu kami juga menyebarkan informasi khususnya terkait dengan COVID, bagaimana pencegahan dan sebagainya. Bisa lanjut. Dari proses yang sudah kami lakukan, ada beberapa rekomendasi yang PK sampaikan, yaitu terkait dengan perlunya bantuan pemberdayaan ekonomi pada masa ini, terutama ini tahap-tahap yang sangat kritis. Kemudian sistem data dan pendataan itu harus berbasis dari komunitas, karena dari yang telah kami lakukan, info dari menurut ibu-ibu, BLTDD yang datanya itu bisa diperbaiki di tingkat desa, itu exclusion error dan inclusion error-nya itu lebih minimal dibandingkan dengan bantuan langsung yang terpusat dari Kemensos misalnya, itu error-nya lebih tinggi. Kemudian perlunya sistem data terpilah secara gender, disabilitas, lansia, dan kondisi khusus lainnya. Kemudian perlu ada kebijakan afirmasi untuk kelompok tereksklusi, misalnya untuk lansia, disabilitas, dan kelompok minoritas lainnya. berbagi pengalaman dari Oke, sudah dari saya.
Ya, terima kasih Bu Rom, udah melewati ini menarik sekali ya, dan begitu besar ya potensi peka dalam modal sosialnya, bekerja bersama perempuan kepala keluarga ya. Ya, saya sepakat bahwa perempuan memiliki beban ganda bahkan 3 kali lipat ya di tengah pandemi ini ya. Lalu Bu Rom tadi menyampaikan upayanya memproduksi, menyalurkan APD, menyalurkan bantuan, pelatihan ekonomi digital, penguatan sistem pertanian berbasis masyarakat, sampai ke pemantauan dan penyebaran informasi. Ini sungguh luas sekali kerja-kerjanya ya, karena potensi ya sudah cukup besar ya Bu ya. Baik, tadi kita sudah mendengar 3 pembicara dari Indonesia. Sekarang kita ingin mendengarkan pengalaman dari negara Asia Tenggara lainnya. I would like to give opportunity for Annalisa Angin. I call you Angin, I'm sorry. Could you share about Southeast Asia experience based on your preliminary study and how neighboring countries are dealing with COVID-19? And also, what are some best practice from other Southeast Asia countries? Okay, time is yours, Angin, 15 minutes. Yeah, Angin, time is yours. Yeah, you can 15 minutes.
Okay, so yeah, thank you very much, and good afternoon to everyone, especially to our listeners and our participants from all over Southeast Asia. So my name is Angging. I'm a researcher. I work with the University of the Philippines Center for Integrative and Development Studies, and we are part of the program on alternative development. So to perhaps to continue to inspire all our participants, I can share with you some of the inputs and analysis and models that we have across the region. So to aid you here, I have prepared a PowerPoint presentation, although it's in English, but the interpreters can definitely help me with interpreting it in Bahasa. All right, so next slide. Next slide, please. Okay. So this is our organization. We call ourselves AltDev of UP Seeds. We are established in 2017, and among the 14 programs of the center. And we are the program that directly works with grassroots organizations and civil society across the region. Seeds, on the other hand, is the policy center. It's the think tank of the university that harnesses multidisciplinary expertise of the university and issues of national significance towards the resolution of the nation's critical problems. And one of the things that we also put focus to is the issue about this intergovernmental body, the Association of Southeast Asian Nations, or ASEAN. So AltDev also looks into development paradigms, policies, practices, and projects mostly initiated by the grassroots that challenge dominant models of development that have largely failed in meaningfully addressing the issues of Southeast Asian people. We also work for people's alternative regionalism that is based on people-to-people solidarity. We always hear we always hear this word from the previous speaker, no? The solidarity and the people-to-people exchange. So here I re-echo again, this is based on people-to-people solidarity, and it's people-led and it crosses borders. Next slide. All right. So perhaps I can give you some of the trends or just a brief analysis. What we observed during the time when all our governments had declared lockdowns, in state of emergency, and others. No? So what went wrong when all these governments have declared such such a health emergency. There are a lot of failures that we see between Indonesian government and perhaps, of course, Philippine government and the other countries. But I can just mention some of the things that we find very prominent among our countries. So first, many countries have not acted with speed, no? So there's this certain level of unpreparedness really on the part of government. So I would like to quote uh, the observation of Dr. Michael Ryan. He's the executive director of the World Health Organization's Health Emergencies Program. And this is what he said. First, there is insufficient preparation among many countries. The second is the lack of muscle memory. So he's referring here to the countries that have learned a lot from past health emergencies, which also possess the capacity to make decisions, to create new science, and to turn that into policy actions. So not all not all countries in our region have that kind of past experience in terms of health emergencies, or probably some of the countries like Vietnam has been quite ready in a way because of their experience with SARS. All right. And then the third is varying levels of social cohesion among countries. So we have different levels of, appreciation about solidarity, about connecting each one of us, ourselves to our communities. So this is about where people see themselves as part of the community, tend to absorb information positively, and act in a more sustainable manner. And the next thing is the pandemic has exposed the long-standing problems of the region's healthcare systems. So most of our countries in the region really have this kind of, this problem about healthcare systems. Now we have poor public health systems. People, especially the poor, have no access to quality healthcare, especially even primary healthcare. And there is meager budget for health research and development. So it's very obvious in our situation now, we cannot even manufacture vaccines. No, we don't have that kind of a capacity to develop the science that we have generated out of this pandemic. And then and of course the reeling problem in our region, which is turning essential public health services to the private sector. So the problem about privatizing basic services, even including health. The next, there is the problem of leadership and governance. No, special. This is very prominent in in the management of the Philippine government. No, in terms of responding to the pandemic. So I would like to quote Professor Q Ying. He's the dean of the National University of Singapore's School of Public Health. He said, when leaders of countries choose to ignore the facts and the science of COVID-19, this is when poor decisions are made that amplify the spread of the coronavirus in a country rather than help to improve the situation. So if it is not really based on science, if there is no um, recognition about the efforts of public health experts and other scientists and other development workers, if we are not, in other words, if we are not part of this solution and government just keep it as a burden for itself, then it becomes a problem. Because if government translates this into policies, and then it's somehow like a disaster, no? And you have people locked down in their residence, in their communities, who cannot really go out and find a job. And then you have and then another thing is national disease prevention and control is really centered on military and police governance. This is very evident as well, no? Instead of relying to the expertise of medical practitioners and public health experts on COVID-19 prevention and control. So draconian, we say it's a draconian measures are imposed by government security forces on violators of public health, violators of health protocols. So yeah, there are a lot of news that has been spread where people are really manhandled, no? Because they were somehow violating some health protocols. And because it's the military and the police who are at the center of implementing this lockdowns and all this health prevention, no? When in fact it should be the health practitioners. Next is lockdown only exacerbated the situation. So it just worsened our situation in the region because it is not insufficient. It is really insufficient. If you have lockdowns, but you do not have social protection measures, especially for the poor, social funds, whatever you have health benefits. This is absent. You have no social welfare funds, or let's say social funds for the workers whose work were affected, whose livelihood were destroyed or were damaged. So these are the things that really worsen the situation of the lockdown. And it's always the poor, no, in the marginalized sector who bear the brunt of the crisis. The last thing that I would like to point out is ASEAN. ASEAN is an intergovernmental body, so it's a body of it's an organization among states. No, it's not really people to people. It's governed by our state leaders. So what I would like to point out here is that ASEAN can only provide statements rather than stress up. And then it stresses, if you see some of the recent statements of ASEAN there in their website, it even stress that post-COVID in a neoliberal character. No? There is always focus on trade, liberalization, on corporations, on foreign investments, on takeover of our resources. And then what I would like to point out is ASEAN diplomacy is always following the principles of non-interference and consensus decision-making processes. In other words, it is limited to state to state. It's never people to people. So I would like to quote, this is from the perspective of home-based workers, no? And this is what they said. When ASEAN adopted the declaration on COVID-19 during their online special summit, it focuses only on ending the epidemic and economic recovery, while very few concerned about the impact mitigation measures for workers, marginalized, and vulnerable people. Even they have the declaration on strengthening social protection since 2013. They already have these declarations about social protection, but they did not use it. There was not even mention of it. So many ASEAN declarations are just beautiful papers. So to quote from HomeNet Southeast Asia. All right, next slide. Okay, on the other side, this is what the communities, the grassroots have been doing. So they are not just people who are waiting for government intervention, but rather it is very obvious that they have their own initiatives as well in order to move forward their practices and to really survive and to express humanity. So what I say here is marginalized communities across Southeast Asia, provided they have embraced the principles of solidarity, social cohesion, cooperation, sharing, and caring, can initiate proper measures to help address a global health crisis. The pandemic has even been an instrument to present to the world that because of these alternative practices they have long engaged, this has made them more resilient in facing the adverse impact of a disaster or a crisis. Okay, next slide. So here are some of the examples. So in the Philippines, we have Buckwheat School. So Buckwheat, they call it a Buckwheat School. Buckwheat means it's a lang for evacuees, no? So these are indigenous peoples, children among indigenous tribes in Mindanao, in the south of Mindanao. To inform everyone, we have around more than 100 indigenous people schools. These are alternative schools in the Philippines. But because of militarization, because of resistance of indigenous peoples on land grabbing, mining, logging, and all these corporate-driven extractive industries in our country, they were, because of such actions, they were branded as rebels. No, they were therefore militarized, and they were harassed by governments because of their resistance. So in order to continue, in order to assert the right of education of these children, some of these children went to Manila. So now they're actually housed in UP, no, in the campus, in some of the colleges. So they are also locked down in that particular building because they cannot go out. These are young people, so they have limited mobility. So right now they have remedial classes, no? So they have to continue the education. They have to have their own psychosocial support system, donations, fundraising, film showing, creative art making, etc. And for the others who are already supposedly who have graduated from senior high, they're supposed to be in college right now. So in order to continue the studies, they are joining some of the classes of in colleges, in universities.
Okay, 3
Okay,
minutes
next
more,
slide.
Angin. 3 minutes more. Yes.
So this one is about the informal economy workers in a resettlement site in Bulacan. No? They call it the maigting na samahan ng mga panlipunang negosyante ng Towerville. So when the pandemic was imposed, their livelihood was definitely affected. No? They cannot go out to have a living. So, but later on, they were able to manage and to contact some of their NGO counterparts and their partners, no, so that they will be able to make uh, protective, personal protective equipment. So they're also sewing face masks and then PPEs, no, for our frontliners. So right now, but before they are sewing or they're manufacturing bags, no, and yeah, textiles for to to sell it, no, on fair trade, etc., and some of the small shops. But that was really affected, so now they are creating face masks and PPEs for hospital employees. So next slide. Okay, so this is the backpack health workers of Burma. So, but this is the part where it's close to Thailand, no? They have been there, these backpack workers, or maybe you can call it medics, no? Though they have already been doing primary healthcare training for communities, for rural communities inside Burma. And these communities are conflict affected areas. So you can imagine the difficulties that they have also, no, in the previous years because of this long-standing war within or internal conflict within Burma or Myanmar. So and they have these volunteers who call themselves the backpack health worker team. So during the time of lockdown until now, they still provide primary health care, but they have to shift some of their trainings about COVID prevention and control. So if you see here in the picture, a worker is instructing the children how to wash hands properly, and then the other is how to wear masks, no, properly as well. And then the next side, the bigger picture, is about the training. So you can see the social distancing that the communities are also complying. So you see here that people are really compliant about these health protocols, no? It's just that we really have to harness all their potentials because they can really comply with government guidelines for their own good, for the benefit, for the health benefit of everyone. All right, next slide. So this is the partner of the backpack workers. This is Maitao Clinic. So this is located in the Thai-Burma border, in Meso. So I visited this last year. It it is being managed by stateless peoples actually, no, because they cannot return to Burma. They don't have legal documents. So yeah, they have to stay in Meso, no. So the director there is a medical doctor, Dr. Cynthia Mao, and because of this COVID, no, they cannot afford to close the clinic. Actually, it's like a hospital also because it's comprehensive. they provide comprehensive health care to stateless peoples and peoples in the border, living in the border. And right now they are continuing they, they have to open the clinic for other other sickness that has affected the communities there. But luckily, when I asked them, so there is no COVID cases that they have encountered, so far, which is very good. And yeah. Okay, next slide.
2 minutes more.
Okay, so Cambodia, same with the Igting of Philippines. So they have shifted. So these are home-based workers. They have shifted their production to making face masks in their country as well. Okay, next. That's HomeNet Thailand. That's also a group of home-based workers. HomeNet is actually a regional organization. So they call themselves the HomeNet Southeast Asia, but per country they have members. I guess they also have members in Indonesia. So here in Thailand, they have also raised funds, no? Actually, all of these HomeNet, home-based workers have the capacity to raise funds in order to support, no, the the members, their members whose livelihood were drastically affected. So here in Thailand, you see people, these are members who are also distributing food packages to their members. And then the other one, they also organize community kitchens in order to serve free food, no, for the members and the community who were really affected. Next slide. Okay, so the next one, this is from Indonesia. To add to our speakers, you also have the Konfederasi Pergerakan Rakyat Indonesia. They also have their own initiatives in response to the pandemic. No, here you have a community library of an urban poor village in central Jakarta. So they operate their community library for the children, no? And at the same time, they have this urban farming that has been managed by their young people. So when I asked them, the organizers, if there are some instances of COVID cases, they said, luckily there was also zero. So I was happy to also know about this, especially that you see the children, no, they are having this community library, but yeah, they are just a small. I mean, they are confined in their own community, so there were no exposure to the disease or to the infection. Okay, next. Next slide. Okay. All right. So this is what I would like to share, no, for my last presentation. What has really taught us during the time, during this time that we face this global pandemic? No, it's a global crisis and it affects every one of us in the world. So what has taught us? Okay, one is the state must allocate more budget on quality public health care and build a robust health delivery system. We witness many community-based or social innovations and people-to-people solidarity. But the government has the greater responsibility to protect its people from a global pandemic or health emergency. Communities need government intervention because their own resources are scarce and livelihood opportunities and public services are badly affected. So my point here is there is a big responsibility of government, and one of that is to provide more investment or more allocation for healthcare. The next is the pandemic has also demonstrated, on the other hand, it has demonstrated that communities through their alternative and sustainable practices have stood out and manifested their resilience in times of pandemic and other modalities of the global crisis. Communities based on their alternative practices have solutions to the problems, no, that has been worsened by the COVID-19. So what I say here as examples, as their alternative practices that made them stand out and become resilient. For example, the sustainable farming, local food movements of communities, land management, agricultural land management of farmers, the provision of primary health care, as what you have witnessed in Burma and the Thai Burma border. You have solidarity economy, the exchange of products the between people. No, these are direct partnership among people who have been affected. And you have alternative schools that, despite the pandemic, children still has to pursue learning. Although, of course, there are some levels of engagement in education, but alternative schools has to be there. No? It has to move on and it has to continue. So according to the community partners of AltDev, no, the COVID crisis brings to light once again the need for extended social protection. And COVID-19 confirms that social solidarity economy is needed. So again, I would like to quote a WHO doctor. No? His name is Dr. Poonam Ketrapal of the Southeast Asia region. The greater investment in public health would help achieve better health outcomes, promote sustainable development, and a more equitable and just society. The next is, there is an urgency to optimize public health care versus privatization of essential health services. I mentioned this again. And optimizing public health care should be in consonance with social and economic determinants of health and well-being. So one of the things that we would like to stress here is to adopt a paradigm that is at the national level, that is a whole of society approach, instead of this whole of government approach that is going on. This entails building multi-sectoral partnerships between governments and all stakeholders, covering all levels of governance and the global down to the community level. So here I have put here maybe four steps, no? At least for now, four steps in order to move forward this whole of society approach. One, science-based government policy formation and action. Two, mobilize the potential of the public workforce for production of PPEs or personal protective equipment. Third, harness public action to facilitate social life. No, when the initiatives of grassroots, no, has to be harnessed here. And fourth is the cross-border and people-to-people solidarity. Again, this is not state-to-state partnership, but it's about people-to-people solidarity, like what we are doing now when we have sharing and we express our solidarity to the grassroots, not just in the Philippines, but it crosses other borders like Indonesia, Malaysia, and other regions. So thank you.
Ziko, you'll have to unmute yourself.
Ya, mohon maaf, Mas Iko masih di mute tadi.
Oh, I'm sorry. I'm sorry. Okay, maybe I'll repeat again. Thank you, Agin, for your brief and concise presentation on the pandemic situation faced by people and marginalized groups in several Southeast Asian countries. Now we will head to Malaysia. We have Sumita here. Sumita, could you share about the situation and condition of migrant workers in Malaysia in the midst of a pandemic? And are there any community initiative to help migrant workers in Malaysia? You also have 15 minutes. Time is yours. Yeah, Sumita. Yeah.
Thank you. I'm going to share my screen. Thank you.
Yeah.
Okay, thank you so much. So I was given 4 questions by the organizers to answer, and I will present my presentation based on that 4 questions. So one of the questions asked was when was the first COVID case in Malaysia, and what was the initial response of the government? So our first COVID case was in January 25th. It was by 3 China tourists who entered Malaysia. And the first Malaysian COVID case was confirmed on 4th of February. It was a 41-year-old person from Singapore. So, but I must say that Malaysia prepared for the COVID way before the cases. That was in December 2019 itself. Malaysia began planning and preparedness activities. They bought the diagnosis reagents in January 2020. There were hospitals, public hospitals designated for treatment of COVID. Example, the Sungai Buloh Hospital was the main hospital for treating COVID, and other public hospitals were also renovated in February 2020 to prepare for the surge of the cases. So what Malaysia did well was all other patients from these hospitals that were designated as hospitals treating COVID were moved to other public hospitals. So these hospitals were just designated only for COVID. They also made sure that no private hospitals were allowed to treat COVID patients. So if there were COVID patients in private hospitals, they were all moved to the public hospitals to ensure the streamlining of the treatments. Between 2019 and to April 2020, they increased the number of hospitals from 26 to 40, and also the number of screenings. We had also more ventilators to prepare ourselves. And one of the good things that Malaysia did was that they hospitalized all individuals with confirmed COVID diagnosis, including the ones with asymptomatic patients, or if they were in close contact with those who were COVID positive, they were also hospitalized in different wards from those who were positive, even though they were asymptomatic. And also they hospitalized those with travel history to places which had high COVID numbers. So this was one of the good things that they did. Another positive thing that Malaysia did was doing a manual contact tracing. So manual contact tracing was done quite extensively in Malaysia. So that was a good thing that we were able, that the authorities were able to identify COVID, asymptomatic patients as well as COVID positive patients. Then, so our partial lockdown, we didn't do a full lockdown. Our partial lockdown took place from 18 March to 4th of June. During this time, only essential industries were allowed to open, like the medical industry, the palm oil industry, the agricultural industry, the security sector, the food retailers, and public amenities like water, travel, sewerage, all these were open. So we had a restriction in time, which means like businesses could only open from 8 a.m. to 8 p.m. And public was only allowed during these times out. You were only allowed out of the house during this time to buy your essentials and go to work. So, and they also imposed a 10-kilometer radius of travel for food and essentials. So you had to go to the nearest shop within a 10 kilometers radius to buy your essentials. And those who were working in that essential sectors needed a letter from the employer to work. They also imposed no overtime. So you finished your work at 5 p.m. and then you'll have to come back. And I must say that many migrants served as frontliners in these essential industries. So what were the migrant workers' access to COVID screening and treatment? So as early as 29th of January, the Ministry of Health issued a circular to applicable to all citizens who were either with symptoms of positive cases, and if you had symptoms and were positive cases, you would be exempted from fees of registration, screening, treatment, and you also had free admission to the ward. So basically your screening and your treatment was free. if migrant workers or foreign nationals were in contact with suspected or confirmed COVID positive cases, they too had the option of free screening and free admission into the hospital. Those who walked in, that means you had no symptoms, but you're walking into a hospital to just do a test, those patients were charged 40 ringgit, which is quite a minimal sum, and there are also other related charges. So, but as the numbers of COVID were increasing in Malaysia, everyone, including Malaysians, if you had no symptoms and if you were asymptomatic, they were asked to go to do testing in private hospitals and clinics, because this was to minimize the overcrowding and the infection rates at the public hospitals. But the unfortunate thing was that the private hospitals, their screening was very expensive. It was almost from 380 to 500 per person. So for a migrant worker, this was very costly. Even for a Malaysian, this was very costly, right? I think another thing that one of the other problems that we faced in terms of migrant workers' access to COVID screening and treatment was the conflicting statements that some of the ministers gave, saying that while the Ministry of Health says that the screening and the testing was free, ministers will say that you will have to pay, you know. So in response to this kind of conflicting statements, civil society and IUM, we designed WhatsApp posters and voice messages in various languages to encourage migrants with symptoms to go to the hospital to undergo the free COVID test without fear of arrest. And this is something that it worked. A lot of migrants went for their testing. And so the second question is, how did the measures affect migrant workers and what hardship they underwent? Although Malaysia had this free testing for migrants as well as for foreign nationals, but they did not give food aid, because when the country closed down, a lot of the workers who were daily waged workers did not have access to food because they did not have access to work to earn the money. So in this respect, Malaysian government's food aid was only limited to Malaysians. So they did not provide food aid to non-citizens like Indonesians and and all the other non-citizens. They did not have access to food aid in that way. And one of the other things that we also found, that a lot of the companies were withholding salaries, and because there were no salaries to the workers, they were not able to purchase essential needs. So the undocumented still had the fear of going out of their homes because they were fearful of being arrested. And there was a lot of overcrowding at the homes itself, at migrant worker homes, because everybody was now staying at home. And before there was a lot of the migrant workers, if there was 20 people in the house, they would work in shifts. So you won't see everybody at home having to occupy the house at all times. But after that, when all the industries were closed, then you saw that a lot of the workers were struggling to stay with many people at a time in the house. Migrant children were not able to attend community schools and also do online learning because there was no facility for the migrant children. So in this period, documented persons were able to leave Malaysia, but the undocumented people, the undocumented migrants, were unable to do so. So because whenever they tried to go out of the country, they were arrested at the borders. But if you were documented, you could leave Malaysia, but there was a restriction that you couldn't come back into Malaysia. Right. So this was also a problem for a lot of Malaysians, a lot of migrant workers who were sitting in the house without salaries. They couldn't go back because they were fearful they would not be allowed to come back in. And there was a heightened xenophobia because there were migrant workers who were COVID positive. And, even though there were more Malaysians who were COVID positive, there was a lot of xenophobia against the community. And also this was heightened because of statements from ministers who were saying that the community, the migrant community, was spreading the COVID disease. So this was not very helpful in that sense. So there was another hardship that that the migrant workers faced, including Malaysians, was the termination of employment. A lot of loss of jobs, and companies closing down because they had no revenue to have the company remain open or even go through the COVID period while the companies were not in operation. So there were certain areas where the number of COVID cases were very high. So any places which had more than 25 cases, they would impose the enhanced movement control order, which is called the EMCO. And you had a 14 days lockdown in those kind of areas. So in those EMCO areas, no one is allowed out of the home, which means that you couldn't even step out of your house to buy your essentials. So how this was managed was that the authorities will provide food to each house. But again, a lot of the migrant workers who were staying in under this EMCO area were not given food, and this is where the civil society had to step in to provide that food aid to the migrants. So upon the completion of these 14 days, unfortunately, the authorities began arresting the undocumented workers. So there were certain areas in Malaysia where a lot of migrants were arrested and detained, and this also brought about a cluster, a COVID cluster in the detention centers. And the arrest and detention only stopped when there was this cluster in the detention centers. By then, over 1,000 migrants were arrested and detained, and over 300 migrants were already infected in the detention centers. So if you ask me what were the expectation of migrants during the COVID time, was definitely access to food and essentials. That was their main issue. So what initiatives emerged to help the migrants, and also from the consulars? I would say that the Indonesian consular, they were quite proactive. I would say they were very, very proactive compared to a lot of other consular or other embassies. So they suspended their consular service from in line with the MCO, which from 18 March, but they still provided new applications for passport extensions through online registration, and then the migrant or whoever needed a new passport and visa could go to the embassy and collect it from the main desk, which is outside. Also, Indonesian embassy was one of the only embassy, I would say, who collaborated very well with the Indonesian community leaders and Indonesian NGOs to provide food aid for Indonesian migrants. The last count, we saw that the embassy had provided almost 200,000 meal packs for the families, for migrant workers and their families, Indonesian migrant workers and their families. So embassies also assisted us, the CSOs, to obtain the necessary approval from the Malaysian government to deliver food to aid to Indonesian workers as well as to other workers. So no other embassy helped us in getting us the approval except the Indonesian embassy. Of course, they were not able to fund us, so CSOs, we funded ourselves. We received public and private funding to provide aid to the migrant workers. So what did the government, Malaysian government do while this COVID was going on? It did not provide a food aid to the migrants, but what they did have policies that they did issue policies during the COVID was the minimum wage still had to be paid to all workers during the COVID. Even if the company was not operating, you still had to pay the minimum wage. So companies that were non-essential and they had to be closed. No worker can be forced to go to work, and you could not terminate workers who did not turn up for work, right? Because you had to close, so you cannot force them to work, and you cannot terminate workers who did not turn up for work. No retrenchment was also allowed during the COVID period. And workers still had the option of filing their labor cases online. But although the cases would be heard after the lockdown, but they still had the option of filing the cases during the lockdown. And another good thing was the SOCSO, which is the compensation insurance that Malaysia has for all documented workers, including migrant workers. It recognized COVID-19 treatment and hospitalization as a claimable disease for all workers. So this also was a good step by the government. So just specifically on what we did, my organization is called Our Journey, and we provide legal representation for migrants of all nationalities. But during the COVID time, we provided humanitarian aid. Why this happened was because an Indonesian migrant leader had reached out to us for aid, for money, because they found that a lot of the workers didn't have food. This was 1 week after the lockdown. So together with the Bar Council and another charity group called the We Love, We Care, We Share, including Pertimik, which is Persatuan Pekerja Rumah Tangga Indonesian Migrant, AMPO, which is a Filipino migrant community, and Balobashi is a Bangladeshi migrant community. We launched the program called Makan for Migrants on 26th of March with a small fund from friends and family. We just raised a small fund. And then we went on to raise public funds. Then we stopped the public funds when private organizations came in to the picture to give us larger funds. So we provided food aid, like example, dried food, like rice, oil, onion, noodles, sardine, egg, dal, potatoes, and also hygiene packs, like shampoo, sanitary pads, soap, hand sanitizer, face mask. And we covered almost about 10,000 migrants and families. We didn't give fresh food because a lot of migrants didn't have fridges in their house. So as and when a private organization gave us vegetables, meat, and cooked food, we would immediately distribute those for the migrants. So if you ask me why we chose these food aid or these type of items, was because these were this food aid was decided by the migrant leaders, and also the list of beneficiary who would receive this aid were also compiled by the migrant leaders and their volunteers. But to ensure that everybody had access to get this aid, we had an online form, we had WhatsApp groups, we had a Facebook reach out to all the migrants. So whoever wanted aid, they would write into us and fill out the form. So one of the things that we did was we didn't want to do mass distribution of food aid, because we wanted to ensure that the very needy migrant community needed those aids. So all applications that we received, we vetted individually, and we will deliver the food aid to the doorstep of the migrant. So we had groups of people doing that for us on the ground. And we covered several states, that is Kuala Lumpur, Selangor, Penang, Ipoh, Pahang, Melaka, Sabah, and Sarawak as well. So we had volunteers working with us during that time. And one of the criteria that we also put in place was those without jobs or not working during the MCO were given the aid. So if you were still the essential worker who was going for work, you would not get the aid because you were able to provide for yourself. We also assisted with rentals, 3 months rentals, but we only managed to reach out to 12 migrants because we had to vet the migrants for that. And we also gave free milk powder, because milk was very expensive for mothers to provide for their children. So we provided the milk that the mother wanted. We did not buy a badge of milk and gave out. We specifically asked the mothers what milk your child drinks, and we buy that for the child. And we were doing that for almost 3 to 5 months. We also provided free COVID testing for migrants who were returning to work, because that was one of the requirements of the government, that the migrants had to have their COVID test before they return to work. We also provided free vaccination for migrant children. And all these aid that we are providing will continue until the end of the year. We haven't stopped actually. So what other services we provided for the migrants was access to passport and registering for flights, because a lot of the flights during the COVID time was chartered flights, not scheduled flights. So the migrants had to register for the flights, and many of them who did not know how to read and write, we assisted in registering them for the flights and assessing their passports from their employers. We also looked into the salary claims for labor cases, access to passports from their employers. And thereafter, after the period of the COVID was over, and there were still people who had not renewed their work permits, still unfortunately was fined. So they had to pay fines, and so we were helping the migrants to go through that process as well. So these are some of the photos that we took during our distribution. We had migrants holding boards because we didn't want other organizations. There were other organizations that were using our photos to source for their own funds. So we had to stop that, and that is why the migrants were using holding the boards showing the fund that they received. So these were some of the construction sites that we went to provide aid. There were almost about 1,000 over people that provide in the construction sites that were given aid. And these were some of the EMCO areas where we went to provide 400, 500 bags of sugar and potato or whatever they needed for the distribution. And these were some of the pictures as well. So in Sabah and Sarawak, we also gave hand sanitizers and face masks to students who were starting school in August. Because the school was starting and there was a regulation that you needed hand sanitizers as well as face masks, and these were given to about almost 2,500 over children in Sabah.
1 minute, Mita.
Yeah. So I think this is very important for us to see what has happened during the COVID and what has happened after the COVID period. All the sectors have opened up, and migrants were asked to take the COVID test. So Malaysians need not take the COVID test before you return to work, but migrants had to take. But unfortunately, there was no proper guideline on who had to pay for this test. So migrants had to pay for the test, which was almost costing them 350 ringgit. There were also many domestic workers and undocumented workers who were not still going back to work because employers were very fearful that the workers may be still infected. And unfortunately, we had a clampdown on documented workers in the wet markets and the stalls. So they were barred from returning to work, even though they were documented. So migrant workers were facing termination of work without proper termination benefits. And there were migrant workers of country of destination not allowed to return to Malaysia, even though they had valid work permits. So documented migrants, you can go out, but you cannot come in. So that was one of the issues. We also had a heightened xenophobia against migrant workers and the migrant worker defenders.
Okay, we have to.
And think these are some of the reading materials. So once you give the slides to the participants, they can read this for themselves. Thank you so much.
Thank you, Sumita, for your presentation on the situation faced by migrant workers in Malaysia in this pandemic and the civil society initiative to help the difficulty they face. Okay, now I'm sorry, I speak in bahasa. Sekarang kita masuk ke sesi tanya jawab. Sudah ada beberapa pertanyaan. Okay, first question is pertanyaan pertama dari Anwar Sastro, ya saya baca ya. Anwar Sastro, ini untuk semua. Pertama dari Bernard Cotton dari Papuan Voice. Apakah di tempat tinggal atau wilayah pertanyaan untuk semua pembicara dari Sastro. Bagaimana menurut the question is lost, I cannot see. This question is from panelist dari Indonesia, dari Miranti Hussein. Dengan data, informasi, dan pengalaman yang dimiliki, sejauh mana hal tersebut dimanfaatkan oleh pembuat kebijakan di tiap tingkatan kabupaten kota atau provinsi. Yang kedua, untuk DRMK dan PK, apakah dalam melakukan kerja-kerja di komunitas untuk penanganan COVID ini, apakah bekerja sama, kolaborasi dengan lembaga atau organisasi lainnya, dan seberapa efektif ini? Silakan kepada pembicara dari Indonesia dulu. Saya persilakan mungkin Ibu Ramlawati dulu ya.
Oke. Baik, terima kasih Mas Iko. Saya sudah menjawab di kolom Q&A, tapi tidak apa-apa. Yang pertanyaan yang pertama terkait dengan kasus yang, kalau kami belum mendapatkan info dari ibu-ibu serikat pekerja terkait seperti yang dialami oleh teman Anwar ya. Kemudian terkait dengan mengembangkan model kedua yang ini yang terkait dengan membangun jaringan ya untuk dalam kerangka COVID, Peka siap lah untuk kalau memang ada gitu ya untuk berkontribusi di dalam jaringan di tingkat Indonesia ya di Indonesia di negara ini saya kira kami siap. Kemudian terkait dengan tadi ada pertanyaan tentang penerapan penguatan ekonomi solidaritas. Jadi kami menggunakan juga mekanisme sistem ekonomi solidaritas yang dipraktekkan oleh ibu-ibu PK. Jadi ibu-ibu PK memproduksi berbagai barang, misalnya memproduksi tenun, kemudian kalau yang pertanian berarti dia menjadi petani, terus kalau kerajinan dia membuat kerajinan, membuat minyak kelapa gitu ya hasil olahannya. Kemudian produksi ini dipasarkan melalui kami sebut pekamat, jadi toko grosir yang memang dikelola oleh ibu-ibu PK melalui pekamat ini sebagai tokonya, kemudian atau dijual ke warung-warung yang dimiliki oleh anggota PK. Nah konsumennya adalah anggota PK dan masyarakat di mana PK berada. Jadi PK sudah menerapkan model ekonomi solidaritas dan ini berjalan. Dan menurut kami ini cukup bisa untuk menguatkan kelompok-kelompok rentan ya. Soalnya PK termasuk kelompok rentan juga. Itu pertanyaan selanjutnya kayaknya buat Sumita dan Engineer. Terima kasih.
Ya, mungkin sebelum ke Sumita dan Angin, Pak Iskandar dan Mbak Heriayati menjawab pertanyaan yang sama. Ada 2-3 menit.
Maaf Kak, diulang tadi pertanyaannya Kak.
Saya bagaimana memperkuat inisiatif ini, apakah ada kolaborasi dengan organisasi lain, komunitas lain? Sebenarnya tadi udah dijelaskan ya sama Mbak Heriayati, cuman bisa dijawab lagi 1 menit, 2 menit.
Ya. Kita berjejaring dengan organisasi lain, tetap kita berjejaring, kita juga menguatkan teman-teman juga dengan kita dengan pertemuan dengan Zoom meeting juga teman-teman, terus kita juga melakukan kita kemarin kebetulan kita sudah meresmikan 16 koperasi yang dibikin yang diresmikan oleh pemerintah, yaitu dengan 16 kampung yang ada dampingan JRMK, ada 16 kampung yang ada sudah diresmikan oleh notaris. Itu pembuatan koperasinya sudah ada 12 ya kalau 11 koperasi yang sudah diresmikan. Nah, kita dengan penguatan membuat koperasi itu dengan harapan supaya teman-teman bisa lebih menguatkan lagi untuk perekonomiannya, untuk mengorganisir teman-teman yang ada di lingkungan kita masing-masing tempat gitu. Tapi tetap berjejaring dengan organisasi lain. Kita juga bekerja sama dengan pemerintah dengan Pemda, dengan terjadinya kita pembuatan koperasi yang diresmikan oleh notaris itu secara gratis, ya, dilakukan secara gratis. Terus juga kita melakukan pendataan warga-warga rentan yang ada di DKI, terus juga yang ada di right miskin kota ya Kak ya, terutama ya. Terus kita juga tetap pendampingan untuk teman-teman yang ada masalah untuk masalah kampung terutama.
Oke. Pak Iskandar, singkat aja. Mungkin ya, udah menjawab ya.
Ya, karena
Ya, halo Pak.
Kami kan kolaborasi sehingga atau gotong royong sehingga mau tidak mau memang pendekatan dan nilai itu. Halo?
Ya, putus
Kedengaran Mas Diko?
koneksinya Pak. Ya, koneksinya putus sebentar ya.
Putus. Oh ya. Sudah bisa?
Ya, bisa Pak. Silakan Pak. 1 menit aja Pak.
Sudah bisa ya?
Ya.
Ya. Nah, salah satu yang sudah kami lakukan kerjasamanya adalah salah satunya karantina pekerja di proyek pembangunan PLTU di Morning saat yang dibuat. Lalu kita coba berkoalisi bersama dengan serikat pekerja di sana, dengan YLBHI dan teman-teman untuk mencoba melakukan advokasi. Demikian pula dengan penghormatan kepada nakes mereka yang gugur yang bukan nakes seperti hakim. Saat ini kami bekerjasama dengan LAIP NGO yang di bidang peradilan untuk mengumpulkan data-data tentang hakim-hakim yang bagian dari penghormatan kepada mereka.
Oke. Ya, terima kasih Pak. Now I want Anging and Sumita to answer. There's a question from Anwar Sastro. Maybe you already mentioned, but you can answer shortly. The question is, how can we strengthen and broaden the values initiative already present today? Is it possible to build network of solidarity between people to people? Yeah, how do we get this started? Yeah. Angin, can you answer?
Oh yeah, okay. Yeah, I've seen the questions. No, I have here 3 questions collected from our participants. So first, about the issue about Papua. So basically, this is about the issue of internal conflict, no, especially that has been affecting indigenous peoples across the region. So yes, it's the same. We have commonalities in terms of this struggle and the resistance of the Lumads or the indigenous people here against militarization and the government imposition of laws. It's going on. So yeah, for Papua, we can only express our solidarity for all the struggling people there, and we hope that you can be victorious eventually in the struggle. And the question from Sastro. So hello, Sastro. So basically, what I could say is we have the global pandemic has limited us in terms of bolstering or strengthening our people-to-people solidarity. No, we are supposed to have people-to-people exchange already. No, Rom here knows about this. She's part of the planning last year. We're supposed to have the exchange of ideas among communities and exchange of struggles and initiatives. But the pandemic has definitely hampered us to move forward. But I could say this time is from the alternative practices of these communities that has stand out in this time of pandemic. I think what we can do is internally in our own communities is to harness all these alternatives. No, this is not just about people practicing their own sustainable development practices, but this is also about, for Southeast Asia, this is also about resistance. So this is about the culture of resistance and solidarity. And we have in a cross-border level, we have to maintain this. We have to continue the conversations. And as it has been mentioned earlier, the use of social media can be a platform where we can strengthen our initiatives. No, even if we are in our homes, we are in our smaller communities, we are locked down, we have spaces, we have imaginary spaces that we can use, we can utilize in order to move forward our agenda. And we have spaces to continue our resistance, because definitely government has a failure in terms of addressing all these crises, no, and that has been exacerbated in the time of global pandemic. So, and yeah, we have to continue our discussion, our sharing. And
Yeah.
that's very important. If we want to inspire other people from other countries, then let's share our photos, let's share our initiatives, let's talk, no? So
Okay.
let we can use social media. The other one is about from Chevy, I guess. Uh sorry. It's yeah, we the the immediate needs of people are diverse, no? Basic needs like food, education, healthcare, these are all basic needs of the people, and government has to address this. It cannot be we have to address first health and then later on education and then later on food. No, this has to be very spontaneous, and these are the basic, the fundamental rights that need to be accomplished. And I think what I could say also, and how can we move forward while we are in this global health crisis, no? The initiatives of communities of grassroots are already solutions. As I said before, these are already solutions to the global crisis that has been going on before. And if we move forward with these practices of communities, these are the solutions to our problems eventually. No? Of course we are in a complicated situation where we have been limited in terms of mobility, but there are spaces that we can still maximize. Uh, we can still move forward our initiatives from the on the ground. So that's all I can say.
Okay. Next to Sumita, maybe you already want some question. Yes, for you.
Yeah,
Like
thank
from
you.
ready. Yeah, yeah. Go ahead.
So I just saw a few questions that about freedom of expression. I think this is in relation to the Al Jazeera case, where the migrant was arrested and deported because he spoke about the arrest and detention in Malaysia. I would like to say that I was the lawyer that in that case that represented that particular migrant. That particular case is more of a warning, not for the migrant to speak up, not to speak up, but is more for the media to not, how to say, amplify anything that the Malaysia government has done badly during the COVID. That's more it. Usually when we highlight migrant worker issues, we are very careful in ensuring that their identity is safeguarded, and that they're not exposed to any harm or identification by the authorities. But in this particular case, the migrant himself chose to be identified. So that is how he was embroiled in this particular unfortunate issue. So I wouldn't say that migrants will have to be fearful. They are still working through the civil society, and their voices are important, and they must not bow down to such pressure and still continue voicing their situation in Malaysia. Another question asked me about the returning to Indonesia. I think there are some migrants who were stuck in Malaysia and want to return. So let me talk about the documented. If you're a documented migrant and you have an employer, you will have to go through the employer to the employer has to allow you to return. So you cannot return without the employer's permission. And if you have finished your contract, then you can return. There's no work in Malaysia and the employer has terminated your contract, you have to register yourself with the embassy, and the embassy will liaise with the employer for you to go back. If you're undocumented, you will have to go through the embassy, obtain your passports, pay the fine to the immigration. Unfortunately, the fine now is extremely expensive. If you have been overstaying in Malaysia without a document for less than 1 year, you will pay 1,000 ringgit. If you have been undocumented and staying in Malaysia for more than 1 year, you will have to pay 3,000 ringgit. So it's extremely costly. So this is why actually we have seen a lot of Indonesians trying to take the boats out of Malaysia through the irregular channel, but it's extremely expensive, extremely dangerous, and also they have caught the borders are all being very closely monitored. So they have actually been arresting a lot of the Indonesians leaving the country through the irregular means. So please don't do that. It is costly to leave. Either you stay in Malaysia, things get better, or you will have to go through the embassy, register yourself for a passport, and pay the fine, and then return to Indonesia. So that is something that I would like to share. There's someone asked about that we have kept the numbers down. Yes, Malaysia have kept the numbers down. We have 32 million population in Malaysia, but our COVID numbers are only 11,000, and our death rate as set today is only 134 death, of COVID. So I have already explained to you how we managed the COVID successfully, somewhat successfully. But now we are having a second wave in Malaysia. So the numbers are slowly increasing. So that is something that hopefully we don't go down into a lockdown into the country, another lockdown into the country, because that's going to be really difficult. So hopefully everybody manages the situation better this time as well. Someone asked about network solidarity, how the countries could work together. I think this is a time that we need to realize that job in Malaysia, example, is going to be really, really difficult. And definitely there will be companies that are closing down and companies that are downsizing, and there will definitely migrants who will have to go back. So Indonesia also has to be prepared for Indonesians coming back to the country. What are you going to do about reintegration? How are you going to provide jobs for workers that are coming back to your country? And because there's going to be restriction on travel. And you also need to look at workers leaving the country, or either through irregular means, being trafficked, being smuggled. Even until today, while the COVID was going on, and even when the country was under lockdown, the Malaysian country government locked down the country, we still had thousands of people trying to come into the country irregularly. So that is something we have to manage, and this is really not the time to point fingers, but we really need to help the population from not leaving the country. So what can the civil society in Indonesia do in terms of reintegration and encouraging the government of Indonesia to create jobs in the country? Similarly, we are trying here also to ensure that the workers that are left here are not arbitrarily terminated from their jobs, and ensure that they get their proper termination dues if the country is closing down. So that is a cooperation that we have to work. One of the things I like to highlight that has been a burden for a lot of the Indonesian migrant workers is a requirement of the Indonesian government that whoever is coming back into Indonesia needs to do a COVID test. Not all countries have that requirement. Indonesia is having that. So if you have to go back to Indonesia, you have to do the COVID test. But I can tell you the COVID test is extremely expensive. It's almost 380 ringgit Malaysia, which is about 80 US dollars. And that's a lot of money for a migrant worker who wants to return. That is per person. I think that is something maybe the civil society could do, because other countries don't impose that requirement. India doesn't impose that requirement. They can just go back to India. But Indonesia having that requirement is hampering migrant workers' return to their own countries. So I think that is something I would like to leave there. Thank you.
Thank you, Sumita, for your concise answer. I think it's already covered some questions. Bapak Ibu, mengingat waktu sudah lewat, mungkin beberapa pertanyaan yang belum terjawab akan dijawab lewat email. Tentunya kami akan menjawab semua pertanyaan. Yang kedua, nanti materi-materi bisa didapat di website IFA di www.ifa.id. Saya ingin merangkum dari diskusi hari ini, mungkin sedikit saya rangkum. Pertama, bahwa dari Indonesia, komunitas-komunitas warga telah melakukan inisiatif di tengah krisis pandemi ya. Ada kelompok perempuan, kepala keluarga, ada kelompok miskin kota, ada kelompok YSO bersama komunitas warga di beberapa wilayah mulai dari Aceh sampai Papua. Mereka tidak bergantung pada keterbatasan yang dihadapi. Demikian pula di Malaysia ya. Malaysia khususnya YSO dan komunitas migrant workers, mereka melakukan upaya penggalangan dana untuk akses kesehatan, untuk makanan dan hand sanitizer dan lain-lain. Lalu di Filipina ada upaya memberikan pendidikan, literasi dan numerasi di komunitas masyarakat adat di Mindanao, dan juga upaya-upaya penyediaan alat kesehatan, pemberdayaan ekonomi di perbatasan Thailand dengan Burma, kemudian juga di Indonesia untuk pengolahan lahan untuk bahan pangan. Satu hal yang saya catat adalah pentingnya solidaritas yang positif sosial. Dan tadi ada tawaran komitmen dari Anging maupun Sumita bagaimana mengkoneksikan inisiatif ini, solidaritas lintas negara ya, regional, karena mungkin kita bisa saling melengkapi. Misalnya dengan Malaysia jelas banyak pekerja migran di Malaysia. Oke, itu saja ya mungkin ya. Mohon maaf jika ada kekurangan. Sebagaimana telah sampaikan, ini merupakan seri kedua diskusi yang diadakan oleh IPA dalam rangka memperingati 20 tahun Yayasan IPA. Ya, mari kita ucapkan nanti ya bulan Desember IPA akan ulang tahun ya ke-20. Semoga IPA bisa tetap bekerja bersama teman-teman komunitas maupun YSO. Ya, demikian dari saya tutup dan saya persilakan Mbak Sherly. Halo Mbak Sherly. Oke, saya pikir saya tutup saja. Selamat siang dan selamat makan siang ya. Salam Bapak Ibu. Thank you Sumita. Thank you Anging.
Terima kasih Kakak. Terima kasih semuanya.
Thank you for having us on the call.
Yeah, thank you, and let's continue the solidarity.
Yeah, of course, we will continue. I will talk to you again. We will talk to you again, Anging and Sumita, in the future.
Sekarang bisa live ya?
Terima kasih Pak Iskandar, Ibu Herda, Ibu Rom. Thank you Sumita, thank you Angging.
Oke, terima kasih.
We'll communicate more
Sekarang
via
bisa live
email.
ya?
Iya, sudah Bu, terima kasih.
Oke, terima kasih semuanya.
Terima kasih semuanya. Dadah.
Mantap, kita ke kampung lagi ya Ma, yang ke situ lagi lah Ma. Yang tadi itu kita